So you're going in for a procedure, and yeah, the whole anesthesia thing can feel a bit mysterious, right? But what if I told you it's less of a mystery and more like a super organized personal safety plan? Today, we're going to pull back that curtain and walk through the pre-anesthesia checklist. You'll see just how much prep work goes into keeping you safe. It's actually a pretty fascinating process, so let's dive in. The whole lot, actually. Seriously, just like a pilot runs through that whole pre-flight checklist before takeoff, an anesthesiology team follows this incredibly rigorous protocol for your procedure. It's a system that's been built from the ground up with one single thing in mind: your safety. So, where does this all start? Well, it begins with a set of universal rules. These are the absolute fundamentals that apply to every single patient for every single procedure, doesn't matter if it's big or small. You can think of them as the ground rules for a safe flight. First up, the room itself has to be perfect. And that doesn't just mean having all the right tools for the surgery. It means having a complete setup for resuscitation, just in case. And here's a big one. All the tech, all the appliances, they have to be modern and up to date. This makes sure the team has the absolute best tools for the job. Okay, so that's the room. Now let's talk about you, the patient. There are 3 universal rules here, and trust me, they are non-negotiable for very good reasons. An empty stomach, getting rid of all metals, and of course, providing your full medical history. Let's dig into that first one a little more, because it's super important. So, what does an empty stomach really mean? Well, it's not one size fits all. As you can see, it really depends on your age. For a newborn, it's just a couple of hours. For kids, about 4. And for adults, we're talking a minimum of 6 to 8 hours. This is a critical safety step to prevent something called aspiration, which is a fancy way of saying we don't want anything from your stomach getting into your lungs while you're under. Okay, so once all those universal boxes are checked, the process gets really personal. We shift gears from the rules that apply to everybody to a plan that is built specifically for you, your body, your health, your history. The first step in building that personal plan is this pretty technical sounding thing called anesthesiologic anamnesis. Whoa, big word, right? But all it really means is a conversation. It's just the medical team getting to know your complete story so they can build the absolute safest plan for you. So, what kind of info are they gathering to build this health profile? I mean, we are talking everything. Your medical history, past and present, any chronic conditions or medications you're on, a full physical exam, and even specific tests like an ECG to get a look at your heart. It's like they're gathering all the puzzle pieces to see the full picture. And all that information, it's not just for fun. This is where it gets put to work. The team uses it to classify a patient's physical status on what's called the ASA scale. And as you can see here, it ranges all the way from a totally healthy patient in class 1 with a teeny tiny 0.1% risk, all the way up to class 5. It's just a really powerful objective way to understand and plan for a patient's unique risk level. All right, so environment is prepped. Check. Personal risk calculated? Check. What's next? We're at the final step in the prep phase, pre-medication. This is all about giving you specific medications right before the procedure to make the whole thing safer and, honestly, a lot easier on you. Think of pre-medication as having 2 main jobs. On one hand, you've got drugs that help stabilize your body's functions, preventing things like excess salivation. Then on the other hand, you've got sedatives. And their job is simple: reduce any anxiety and just make you comfortable. They work together as a team to make sure the start of the whole process is as smooth as possible. Now, this right here is a perfect example of that personalized care in action. This is a direct quote from our source material about a really critical safety step. See, for patients who are on certain blood thinners, the team will temporarily switch them to a different kind, one that's much safer and easier to manage during an operation. It's a small change that makes a huge difference. And while some medications need to be adjusted, here's something that might be reassuring to hear. You don't have to stop everything. Most patients can actually continue taking their daily meds for chronic issues like high blood pressure or diabetes. Of course, your doctor's going to give you the exact game plan for you. So when you put it all together, what does it all mean? Well, what we're looking at is a system with layers. You've got these universal standards that protect everyone, combined with this deeply personalized care plan on top. And the most important thing to remember is that every single step is deliberately designed for one thing: your safety. And if you want to see the result of all that hard work, all that preparation, just look at this number: 0.1%. That is the mortality risk for a healthy patient.
That single statistic is just a powerful testament to how incredibly effective this whole system of checks and balances really is.
All this preparation and personalization, it's just a testament to how far medical safety has come. It really makes you wonder, right? As our science gets smarter, as our technology keeps getting better, what will the next generation of these pre-flight checklists even look like? Just how much safer can surgery possibly become? How close to zero can we get?